Looking upon the first day of the Congress, I'm very much satisfied. First of all, I'm very much satisfied for the number of participants who arrived yesterday. Actually, there are almost 500 participants of the Congress, and of course, in the whole scientific program, which is actually the most important. The first day is usually the most important day of the whole Congress. It's very much satisfactory. Just looking at the presentations and being in the presentations where I was sitting at, the interest and the quality of the presentations were very much at the level we have been expecting, and I think for the first day we can be very much satisfied. I think this time Professor Davidovic and Dr. Končar were very much, and Professor Fabri for cardiac part. They invested a lot of effort and their time, and also they attracted the industry to help them to organize such a big Congress. I think that's a big achievement for the local medical community as well as for the city of Belgrade and Serbia on whole. I see a very bright future for TAVI. I think, of course, it is very much expensive. We all hope that by the time the prices will go down and that the majority of patients who need such a type of therapy can get it.
Could you please compare minimal invasive surgery with TAVI?
You know, it is a totally different strategy, of course, and if you have, I think it's very good to have a strict indication for TAVI, for it is still very much expensive, and minimal invasive surgery for aortic stenosis is less expensive, but I think everything is dependable upon the diagnosis. I think these two procedures are totally different ones, and they have to be looked upon as those. There is no problem in coronary surgery. The problem is actually almost all problems are solved. I think that for cardiac surgery part, I think we should further on finalize and make our methods better. But actually, there is the survival for coronary surgery and the complication rate is very low, and survival is less than 5%, so less than 1%. So actually, we can look upon this surgery as a solved problem. I think it is, especially for if you're talking about Serbia, for example, my advice would be to try to enter the Eurotransplant organization, Eurotransplant Foundation, as soon as possible and try to increase the number of donors. I think for increasing the number of donors, it is a broader social and media approach is necessary. If this is being achieved in a couple of years, Serbia can enter Eurotransplant successfully.
European Society for Cardiovascular Surgery is organizing summer school in the last few years. You are the host of one of them this year. What is the main or aim, objective of this course this year?
This year we have a topic, the diseases of the thoracic abdominal aorta. So it is devoted for young vascular and cardiac surgeons. It will be held in Poreč in Istria, and hopefully we'll get 20-25 young residents who will have 3 days of lecturing of the prominent members of the executive committee of this society, and we try actually to invest some effort and some money into our younger generation to get good knowledge and information about modern medicine.